build a crown for tooth number 31. First thing I might point out is that as I close the model and look, it looks to me like the amount of clearance that I have to build my crown is less than ideal. So when I'm looking right in here, it looks to me like that cusp is almost touching right there. So before I start, I'm going to relieve a little bit of the stone on the crown prep just to give myself extra room. So the place that seems to be the least adequate is right here towards the distal. I'm just going to take an instrument. We'll do just the same thing we've done in the past, which is to warm up some wax, just add to each side. Now, one of the problems I've seen on some of the projects that have been submitted is that the wax is crumbling. Your crowns keep falling apart, probably due to inadequate warming of the wax. So you need to get your wax nice and warm. Make sure it's adequately warmed. You can see I'm just tracking around. All around the perimeter. We'll go ahead and build up just a little bit on the top too. I'll continue this building up process until I... Okay, as you can see, we've just basically built up a blob of composite here. Not composite, but of wax. And we've trimmed off the excess away from the margins. And we've got a nice contact up against the other adjacent tooth. At this point, I haven't done anything to form the interproximal. What I'm going to do is I'm going to take my instrument, warm it up. I'm going to heat the surface of this wax. When I have that relatively warm and soft, just take and close my articulator and take an imprint of the opposing tooth in the warm wax. You can see where it's left some dents where my cusp tips are. Now those will become some guidelines or guide points for me as I move along here through my carving. So the first thing to do in establishing the anatomy is to first get the profiles right. If you look straight down at this tooth, you'll see it's bulging far too far out to the facial. The lingual is not too bad. It protrudes about the right amount. But let's start by working on our outside dimensions. So I'll just take a knife and trim that back a little bit until it's in the proper dimensions, facial lingually. If you want to know if you're in the proper dimensions, you can take and look down the line and see whether it's following the same profile as the others. Also, you could look from an occlusal view. So I'm going to go ahead and work on dimensions, facial and lingual, and then I'll restart the recorder. Okay, you can see we've formed our outside and inside dimensions, so it follows the line of the facial and lingual lines. Also, you can see that I've added a little bit of wax to the mesial and distal facial cusp, so that when I bite down, I can establish some sort of occlusion with the tooth above it. So again, I just took a warm piece of wax, placed it right here, and then closed the model. So now we're going to go ahead and form the occlusion on this tooth. Again, we'll use the reference as reference our tooth on the other side. As I look at the tooth on the other side, it's pretty much a well, somewhat of a curvy line coming through the center. There's a depression right here in the midpoint. That's called the central pit. There's a mesial and distal pit. So it's kind of like a cross with a little waviness to it. So let's go ahead and start to form that over here. I'm using the sharp end of a cleidiscoid. I'll form a little Y portion up here that forms the mesial pit. And I'll come right through the center to form that central groove. We'll come up here between the mesial and distal cusps on the facial side. Then we'll start to form that Y branch here on the back that forms the distal groove, distal pit, and we'll form through here. So I just you see, I just work my way around the perimeter and try to capture each side of each line. Let's see if I can zoom in just a little bit closer. So we'll form our marginal ridge. We'll start by forming that little occlusal embrasure. Going back and forth across here. And then still with the sharp end of the cleidiscoid, you can just watch while I form. Oh, here's a good point. Make sure your marginal ridge is the same height as the marginal ridge on the adjacent tooth. That's always a good guideline. So just go back and forth until you have about the same height on your marginal ridges. Then form that occlusal embrasure. And just take your instrument, work your way across each side of each line. I'm just going to work my way around the perimeter. Now we'll come across the lingual side, same thing. Like I'm making a little semicircle around each cusp. Now you'll see some extension of the anatomy out to the facial and lingual, so using the rounded end of the cleidiscoid, I'll just come over here and just gently separate those cusps. And same thing here on the lingual. Just do some gentle separation of the cusps. Got the little piece of nylon. Just lightly rub across the surface. This is a soft enough wax that some of the imperfections are coming out of the. You can almost rub some of the irregularities in the wax out with my nylon. At this point, we're going to go ahead and form our contact. You can see I pull my die out. There's a little bubble right there, which we'll fix. But the contact area that I want to preserve is this area right here. You can see where it's touching the adjacent tooth. That's what I want to preserve. So when I go to form that contact, I can smooth all around that, but I don't want to touch this area. I'm going to leave it completely untouched. We'll come in with a worm instrument and fix that little divot right there. It's a good time to touch up your margins in approximately 2. Let me pause that while I repair that little bubble. Okay, you can see that I've kind of been playing with the anatomy here a little bit. We've smoothed and polished, filled in all the little divots along the sides. We've carved the wax right up to the margin, but not beyond. And you can tell just by looking at it that I've flamed it. So when we flamed it, we end up losing a little bit of definition. You end up kind of rounded on the top. So then you have to go back through with your cleoid and start to redefine those margins. What you'll end up with is kind of a balloon shape along these cusps. So I'm going back through and just redefining all of those slopes. And at this point I'm going to begin to add some secondary anatomy. So secondary anatomy are branches off of the primary anatomy. So you can see the primary anatomy comes right up here through the center. Secondary anatomy will be small branches that come off mesial and distal to that primary anatomy mark. So for example right here, just to break this cusp up a little bit, we're going to put a little secondary anatomy up as a branch. You can see how that kind of breaks up the cusp and gives it a little bit more character. We'll come around on this side, do some of the same. Gently track our way through the groove. And again, we may form just a little bit of secondary anatomy branching. Redefine our marginal ridge once more. That distal pit. Over on the lingual side again, we're going to redefine our primary anatomy, coming up between the cusps, out and over, and we'll break it up with a little bit of secondary anatomy branching off of that. With this soft wax, you may just want to press it in with the soft or the back side of your cleoid. Rather than carve it, you may want to just press it. You also might want to consider wrapping your cleoid in some nylon and just rubbing through the grooves. And that's puncturing the nylon. At this point we can recheck our occlusion, make sure that the model is still closing properly. It feels like it is. We're getting a nice solid sound of stone touching stone. Not getting any imprints on the tooth that look atypical. And just align once over with your nylon, and you should be about done with this project. Q-tip also might work quite nicely here, just to run through those grooves, just to get something that's small that can get into the grooves properly. So, there you go. We're done.